Hmm. Right.
All right. Good evening, folks. My name is Javonne Rich, and I'm the policy advocate for the ACLU of Delaware. Thank you so much for joining us this evening to talk about a very important issue. Tonight, we will be discussing the impact of COVID-19 in Delaware's correctional facilities, as well as what we can do next. What can we do to protect the lives of those who are incarcerated and to keep them safe? Many of you joining may have just left the committee hearing to discuss House Bill 37, which we will speak more on this evening. But before we begin, I would like us to take a moment of silence for the 13 incarcerated people who lost their lives to COVID-19 in Delaware. So we'll just take 20 seconds beginning now. Thank you. I'd like to begin by thanking our co-sponsors who are not only just our co-sponsors for this event tonight, but have been instrumental in advocating for those who are incarcerated and for smart justice goals. And that includes Congregation Beth Emeth, Community Legal Aid Society, Delaware Cannabis Advocacy Network, Delaware Center for Justice, Delaware Coalition to Dismantle the New Jim Crow, Delaware United, Southern Delaware Alliance for Racial Justice, and the Unitarian Universalist of Delaware Advocacy Network. Thank you so much. Speaking with us tonight, we have Sarah Farjardo, who's the policy director, speaking on the impact of the New Jersey Public Health Credit Bill. We will have Ed Gibbs, who will share their personal and family experiences with COVID-19 in correctional facilities. David Bever, the executive director with the Delaware Center for Justice, will speak from the reentry service provider perspective. And hopefully, if the committee meeting ends in time, Representative Minor Brown will be able to join us to speak more on HB 37. After folks share more about what their topics are, we will end with a Q&A with our speakers. So first, Sarah, could you give yourself a more formal introduction than I have, as well as share your experience with the introduction and passage of the Public Health Credit Bill in New Jersey, and why was it important for that bill to pass?
Sure. Thank you so much, first of all, for inviting New Jersey to join this really amazing event tonight. So proud to talk with some folks in Delaware. I see in the chat we have a few New Jersey representatives, so I'm really excited to see some Jersey pride here. And thank you, Javonne, for the really thoughtful question and framing for tonight's event. I really appreciate the moment of silence for those who lost their lives in prison to COVID-19. At the core of this issue, we know that this is about people's lives and survival. We know that our prison system, in fact, our criminal legal systems across the country, in Delaware, in New Jersey, are inherently having harmful racist impacts on our Black and Brown community members. And so I just really appreciate the acknowledgement of life, right, and lives at stake. This is what the fight's about. This is what the effort's about. And that's really how ACLU New Jersey advanced a public health emergency credit bill. You know, back when the COVID crisis started, we were getting panicked phone calls from folks in prison. We're getting emails. We're getting really scared and panicked contact from everybody in the system, right? So we were hearing from parents, we were hearing from partners and loved ones who had folks inside, and people who were, you know, experiencing lockdown or no response in prison and just total fear. We started as ACLU, and as you know, we're linked into lots of really amazing grassroots organization groups. We're linked into a network of survivors of solitary confinement, and from across New Jersey, we were hearing about deaths in the prison system. And so we were hearing about, you know, youth deaths. We heard from a mom who lost her child and only heard about his death days after the fact, didn't know that he had been rushed to the hospital for COVID. We heard from nurses who worked in prison who were being exposed and then dying of COVID-19. We were hearing about corrections officers and from corrections officers who were dying of COVID-19 in the prison system. And so this just escalated extremely fast across the nation, of course, but in New Jersey, this is how we saw it. And very quickly, we saw that New Jersey had the highest prison death rate in the nation. And so this exploded and continues to be an issue. And so how this bill came to pass in New Jersey was really due to strong partnership between family members who were concerned for the loved ones inside, through advocates who stepped up and represented people in the courts and in the legislature, legislative leadership, our governor signed on to. And so it really was a full community effort to make sure that we were saving lives for everybody, right? Because people were coming to work in prison and going home and transmitting the virus to their family members. Folks were visiting, et cetera. So I won't belabor that point, but I think we all deeply understand what's at stake there. And so how did this come about? We were having conversations at the grassroots level, and then we started talking to legislators. Our legislative champions, Senator Poe and Assemblyman Mukherjee, recognized that there were already systems options that prisons use all the time in the form of sentence credit to reduce sentences and allow folks to go home. And so, we took this idea of sentence credit, which applies for good behavior, work and education, things that people do. And we thought about, the conditions people were in prison. So, folks were basically in solitary confinement. People were being let out of their cells and their housing half hour a day, maybe to call somebody, maybe to take a shower, but it was all congregate care. And so the bill was developed to provide a sentence credit for folks who were going to get out anyway, that were coming home anyway, and really was aimed at making sure people came home alive, that people who were coming home had their date moved up. And in New Jersey, it was moved up at a rate of 4 months, I believe, with a cap on like an 8-month credit, right? So it's 4 months served during the COVID-19 pandemic with a cap of 8 months credit total. And so folks started to, hear about the bill. We had really, a lot of conversations with public health experts, and this concept was vetted by our public health experts and prison policy experts in the country. And yeah, the goal was to reduce the prison population, to save lives, to thin density. And so, it was, I think, 4 or 5 months of a New Jersey conversation. We talked through a ton of different parameters, and I know that we're going to have some speakers talking about, I think, personal experience, but also like from the reentry perspective, which I think will be great to hear from. We talked through, what reentry looked like with our legislature and with our reentry providers. And as of January 4th, 2,878 people in New Jersey have come home due to the public health emergency credit. And so that's both juveniles, so youth, and adults. It was the largest single-day decarceration effort in New Jersey history. I was at Newark Penn Station, which is one of our major, train station hubs, and I'm starting to tear up, and it's not an act. Just seeing folks, the relief on people's faces coming home, and we were standing shoulder to shoulder with advocates, volunteers, reentry providers to meet people at the train stations, and we were handing out masks, we were handing out gift cards, we were handing out PPE. The city of Newark and different cities across the state really stepped up and connected folks with housing options and reentry services. Is there more that we can do? 100%. In New Jersey, advocates are committed to building out strong and even stronger reentry protocols. But just to see the relief and hear the relief that people were talking about being able to come home and just seeing loved ones hug their family members tight, and just the sheer joy that we witnessed that day and continue to witness has just been so incredible. And I'm excited to hear more from Delaware and more from all of you leaders in Delaware about the journey to do, to address COVID in prison and save lives. And I'm here to say that, it was a mass incarceration release effort. It's a mass decarceration effort. The sky has not fallen in New Jersey. Our state is still standing, and folks had their lives saved and continue to, survive and thrive. And so, yeah, just a big thank you for having me here today, and best of luck in Delaware.
Thank you, Sarah, for sharing that. What an amazing accomplishment. And just for those who are on, I didn't really quite explain what HB 37 fully would do, but it was modeled after New Jersey's bill. So today, as the bill is written, it would allow for public health emergency credits for up to 1 year release time. So for those who are whose sentence will be expiring within the year, they could be released sooner, way sooner than that. And that bill is being heard in committee right now as we speak. So thank you again, Sarah, for that information. Next, we're going to have Ed Gibbs share about what his experience has been with COVID-19 in correctional facilities. Ed? Ed, are you able to share at this time? Okay, so we'll come back to Ed. Ed, wait a second. I think Ed is here. All right, great. Ed, hi. I was just turning the mic over to you to share your experience.
Yeah, it was the mute. I don't know how it works this thing.
But you can, your microphone is unmuted now, so you can go ahead and share your experience.
Okay. Can't see me though, can you? Hello?
No, we can't see you, but we can hear you.
Man, my son stepped outside. Okay, well, anyway. Dear members of the House Committee, Corrections Committee, my name is Edward Gibbs and I live in Bridgeville, Delaware. I was incarcerated for 17 years before my release earlier this month. For about 2 years before COVID-19 hit, I was working in the kitchen at James T. Vaughn, earning good time credits towards early release. When lockdown began because of the pandemic, to earn that time off my sentence. Well, it was paused and was and in that time I lost almost 20 days of good time. That might not sound like a lot as you listen to my testimony, but losing that time meant that I wasn't able to leave prison before COVID cases started to rise in December. I'm 61 years old and I have a few underlying health conditions, asthma, high blood pressure, and an enlarged prostate. Because of my age and my health issues, staying incarcerated through the pandemic was especially hard mentally, physically, and emotionally. In addition to concerns about my risk, I was nervous about the fact that guards were coming into my building sometimes without masks, who were coughing and showing other symptoms of illness. I did my best to stay clear of them when that happened, but you can only go as far as your cell allows you to go. Eventually, I was moved to SCI in Georgetown and then Plummer Center in Wilmington, where I stayed until my release. At both these places, I was able to earn some good time credits, even though we still weren't allowed to do official work release programs. The good time I earned at SCI and Plummer led to a 10-day early release in the beginning of January, and I'm grateful for that. But if I had been able to earn all the credits that I was supposed to, I could have been able to get out of prison in mid-December and spend the holidays safely at home, not in a cage where COVID was running the show. I'm asking you to pass HB House Bill 37 so that others who are still incarcerated don't have to live in this constant fear and worry that I did. I'm one of the lucky ones. I didn't catch COVID while I was inside, but serving a prison sentence where a virus makes the rules is a punishment that no one deserves. Thank you.
Thank you so much for sharing your experience with us, Mr. Gibbs. And it sounds like you are at home right now. Were there did you receive any help from any reentry programs or from your family in making sure that you could be home safely?
Well, reentry helped me. I forget this guy's name. I think it was Doug or something like that. But anyway, I forget his name. But I did get some help. I filled out the paperwork, and they helped me get with the process of the Medicaid. And now I got to find me a primary care doctor. I also need surgery on my left knee. They had me climbing up and down on a top bunk a couple years ago, and I have a tear in the meniscus, and they wouldn't give me no surgery due to the COVID, they said. But my knee was messed up long before the COVID hit. So they told me I had to get it done myself when I get out here.
So, and thank you again. It sounds like there were also some delays with medical care during this pandemic and in correctional facilities as well. So yeah. Thank you so much, Ed. I'm sure that we will continue talking. And next we will have David Bever share more about what the Delaware Center for Justice does in regards to reentry.
Thank you. Yes, my name is Dave Bever. I'm the Executive Director of the Delaware Center for Justice, and reentry is very important to me because it's such a huge part of what we do at DCJ, but also because I began my career as a probation officer and sort of lived and breathed in reentry. DCJ has been engaged in reentry work for over 20 years in Newcastle County. Our Community Reintegration Services Program, or CRSP, offers evidence-based case management support, housing assistance, job search assistance, help with securing identifying documents, mental health and substance abuse referrals, educational and vocational placement, life skills, and social support to folks who are reentering the community. This work is important because access to evidence-based reentry programming can reduce recidivism by up to 31%, according to the National Institute of Corrections. In 2019, we expanded CRSP into Kent and Sussex counties and added some cognitive behavioral support groups to the program. And just last year, we added transitional reentry services, which connects us with folks literally at the prison gate, and sometimes even before, because we're now involved in the pre-release planning process as part of this project. In addition to case management, transitional reentry services includes peer specialist support from DCJ staff who are formerly justice involved themselves. They offer real-time support and transportation to help folks navigate the crucial first 90 days after release. Because stable housing and employment are two of the biggest indicators of successful reentry, we partner with the Department of Housing and DOC on a project that permits returning citizens to live with supportive family members who are living in public housing. And we also work with 2 fish home renovations to connect formerly incarcerated people with employment opportunities in the construction. Navigating reentry is tough enough under the best of circumstances. In the age of COVID-19, it's virtually impossible to manage by oneself. John, whose name has been changed, was someone DCJ worked with. He was homeless and out of work when he was released from prison in March at the beginning of the pandemic lockdown. With help from DCJ and support, we connected him with a place to live, food stamps, Medicaid, even a lead on a job, even in the middle of all of this. Of all the people I've encountered in the justice system, John said, you're the first person that's made me feel like you truly care. I feel like things are finally starting to fall into place for me, even though everything is chaotic in the world. DCJ is concerned for the safety and well-being of those incarcerated in Delaware and the correctional staff who work with them. We support House Bill 37 for that reason and for all the reasons that have been mentioned so far during this presentation, but also because we know reentry programming works. 2 weeks ago, we signed on to a letter with 3 other reentry providers in support of the bill. Our co-signers were the Way Home, the Wilmington Hope Commission, and Project New Start. Like so many other reentry programs in Delaware, we've all stayed strong throughout the pandemic, and we're prepared to help any prisoners who would be eligible for the public health emergency credit. With COVID-19 devastating families here in the first state, folks need to be home, they need to be working, they need to be supporting themselves and their families. CRSP and similar programs are uniquely positioned to help them because of our specialized knowledge and links to resources in the community. Thank you.
Thank you, Dave. Now, one part of discussion about HB 37 passing is how would that large number of folks be able to get the help that they need? So what do you have to say about your program's ability to help folks?
We've committed to taking that on, whatever it looks like, and doing everything we can to make sure we can meet the need. Obviously, any additional resources we can get in terms of support of our work financially is important, but we will meet the need as it comes to us. And we do communicate with other reentry providers to make sure we're supporting one another.
Great, thank you so much for that. Now, I would like to inform our viewers that at approximately 6:10, there were 17 more people giving public comment in regards to HB 37, hopefully 17 more people who are supporting that bill. So if we could hop into answering some questions from folks that are on the panel today. If you have any questions, feel free to put them in the chat as well as the Q&A section. And if you're following along on Facebook, you can write them in the comments there too, and we'll be able to read them. So our first question of the night is, how do returning citizens get connected to DCJ?
Sure. I'm our director of reentry, Jessica Alisea, would probably be the best person to answer this question, but I think someone should talk to their probation officer directly about CRSP and say, I think this might be a good program for me. And then their probation officer could make the referral. In terms of transitional reentry, whatever reentry staff someone's working with on the inside would be the person to ask that question of as well.
Now, does DCJ start to work with folks while they're incarcerated, or is it after they've been returned home?
That program is actually the first time our reentry service is connected with actual reentry planning. For the most part, folks come to us after they're out. Although we do have other programs that are not related to CRSP that work inside the.
All right, thank you for that. And it seems that we have someone who would like to share their story. And I think Morgan is going to connect them in so that they can do that. Hi there.
Hi.
Hi.
Hi, I'm logged on under my daughter, but I'm Shafonda. And I just have a comment on a personal level and on a professional level. I first want to say that I have a brother who's an inmate at James Vaughn. He had COVID the week of Thanksgiving. Given a little bit of back history, he also has stage 4 cancer. As of today, he is fighting for his life on the vent. My biggest concern was, what was the prison doing for inmates who were already immune compromised, and what preventative measures were being taken for our loved ones who were immune compromised.
I'm sorry, can you repeat the question?
So my biggest concern is that he received a positive test the week of Thanksgiving, November, which means because he tested positive, that he was not able or not allowed to go out to get his chemo treatment. I believe that his cancer was already progressing, yes, but it became more aggressive with him not receiving his chemo treatment. He tested positive for COVID, and because he tested positive, then he was not allowed to go out and get his chemo treatment. So moving forward, I'm a healthcare worker, and in long-term care, we have to get tested twice a week, mandatory, in order to go to work. I felt as though there was no preventative measures to protect those who were already immune compromised. And I also feel like there was nothing in place for the inmates that were immune compromised, leaving them more susceptible to getting COVID.
Thank you so much for sharing your experience. And you're right, those who are immunocompromised are especially at risk for COVID-19 during this time. And I would love to speak more with you about your family's situation. So if you could remain on the chat, and I'll get you connected to the right person at the ACLU. But thank you so much. Now, someone in the chat also stated that I understand that the governors of neighboring states have acted more aggressively from their offices than HB 37 proposes. So yes, governors in our neighboring states did actually sign executive orders that alleviated the stress of the incarcerated population. That led to people being able to return home from incarceration during this time. So at this point in Delaware, our governor did not take that step. So we are hoping that the legislative body will be able to provide relief in that instance. All right, so that sounds like all the questions, or seems like all the questions that we have for tonight. Unfortunately, it seems that the committee is still ongoing, and that Representative Minor Brown will not be able to join us for tonight's event. But thank you all for joining tonight. And we hope that you'll be able to support this bill, reach out to your legislators, as well as sign our petition in support of this bill.
Okay. Have a good night.
All right, thank
Thank
you.
you.
All right.